Air pollution doesn't affect everyone equally, and it never has. While smog might drift across cities without checking your bank account, the people who suffer the worst consequences of dirty air often live in zip codes that were never given a chance. From highways carved through low-income neighborhoods to industrial sites planted next to housing projects, the invisible cloud of environmental injustice has long hung heaviest over marginalized communities. And now, a wave of neurological research is confirming what many suspected all along. Air pollution isn't just an environmental problem or a respiratory threat. It's a cognitive time bomb, and it's exploding disproportionately in the minds of the poor. In communities with lower socioeconomic status, especially communities of color, exposure to airborne pollutants like PM 2.5 and O2, black carbon, and ultrafine particles is often a daily fact of life. These particles come from traffic congestion, power plants, refineries, waste incinerators, and other sources that just so happen to be located far more often near marginalized populations. This isn't a geographic coincidence. It's the legacy of decades of racist zoning laws, redlining, and political neglect. It's not that wealthier neighborhoods have cleaner air by chance. It's that they had the power to keep the pollution out. And while dirty air affects the lungs and hearts of all who breathe it, the impact on the brain may be the most insidious of all, especially in children and the elderly. Studies have shown that kids growing up in high-pollution neighborhoods perform worse on cognitive tests, have lower IQ scores, and exhibit more symptoms of ADHD and developmental delays. The exposure starts early, sometimes in the womb, and compounds over time. Chronic exposure to PM 2.5 and nitrogen dioxide has been linked to smaller brain volumes in children, impaired working memory, and behavioral dysregulation. Imagine trying to concentrate, remember, and learn while invisible toxins quietly sabotage your prefrontal cortex. That's the daily struggle for millions of children who never had a say in where they were born. And the inequality doesn't stop with childhood. In older adults, living in highly polluted neighborhoods accelerates cognitive aging and increases the risk of Alzheimer's disease and other forms of dementia. Seniors in low-income communities often live closer to traffic corridors, industrial zones, or outdated housing with poor indoor air quality. Their brains are subjected to a cocktail of environmental stressors, pollution, noise, poor nutrition, chronic stress, all of which synergize to speed up neurological decline. And because healthcare access is often worse in these areas, early symptoms go undiagnosed or untreated, further widening the cognitive chasm between rich and poor. The science is clear. The neurological harm of air pollution is not spread evenly. It is concentrated, like the pollutants themselves, in places where people are already vulnerable economically, politically, socially. This is not just a public health issue. It's a civil rights issue. It's a slow-motion cognitive assault that disproportionately targets the very populations with the fewest resources to fight back. Even more disturbing is that the cycle reinforces itself. Poor communities with lower average cognitive function due to environmental exposure face greater barriers to education and employment, perpetuating poverty and further limiting mobility. This creates what some researchers call a neurodevelopmental feedback loop, where the cognitive impacts of pollution become part of a multi-generational trap. Clean air, it turns out, is not just about health. It's about opportunity. It's about justice. And despite all this, policy change moves at a glacial pace. Regulatory standards are still written around population-wide averages, not around the communities bearing the heaviest burdens. Air quality monitoring stations are often located far from the most polluted blocks. And even when data shows clear harm, enforcement is lax and compensation non-existent. No one is going door to door in polluted neighborhoods apologizing for decades of avoidable brain damage. So, what happens when cognitive harm is normalized for certain groups? When a child's potential is silently stolen by the zip code she grows up in. When elders fade faster, not because of age, but because the air they breathe every day is laced with neurological poison. The answer isn't just more studies. It's action, policies that prioritize environmental cleanup where it's needed most, infrastructure investments that don't bulldoze through the same communities every time, and public health efforts that treat cognitive equity as fundamental, not optional. Because until we address the toxic air inequality in our cities, we're not just leaving people behind, we're eroding their minds while pretending it's just the weather.